The cervical brachial plexus has several nerve levels that are going to come together, where it's going to then transfer and branch information, where we then travel down and we get a splitting of our three major nerves of the arm, where we're going to see branch points of the radial, median, and ulnar nerve. Through the elbow on the medial aspect, we're going to see the median nerve coming down, cutting under and through the pronator teres to go deep into the wrist flexor muscles. We'll see the ulnar nerve cut down through the cubital tunnel, cut back up under, well, we'll pick it back up again. On the lateral aspect of the hand, we see the ulnar nerve and its artery go over the top of the flexor retinaculum, where it's going to feed the fifth, fourth, and third digits. The median nerve, on the other hand, is going to cut underneath the flexor retinaculum, where it's then going to branch and innervate the first, second, and medial aspect of the third digit. We see the nerves through this area. Anything that causes an entrapment or compression on the nerve can then affect the muscles or sensory that it innervates. So for example, we see weakness in pitch grip strength of the thumb to little finger versus the thumb and index finger. The median branch of the nerve is going to come right up to the thumb, where we're going to then control thumb flexion and adduction. People with carpal tunnel are going to very commonly describe numbness, weakness, or tingling in the first, second, and third digits. They'll feel their hand go to sleep at odd times, especially if their wrist is curled up, like when they're sleeping. With wrist flexion, you're then going to compress the carpal region that much more, further compressing the nerve. In any contained space, the softest tissue is going to squish, which happens to be nerves. Any treatment where we have median nerve problems at the flexor retinaculum is going to involve decreasing pain and inflammation that's compressing down on that nerve. You're going to see several surgical procedures that work at opening up this area to relieve that compression. Conservative treatment is going to involve decreasing pain and inflammation in this region with different modalities such as ultrasound, electric, cold laser, massage therapy, manual therapy techniques are going to work at decreasing the muscle spasms of the wrist flexor muscles, as the wrist flexor coming off the medial epicondyle, cutting up and through. As they continue to contract, they're going to further compress the carpal region. Relaxing these muscles will help decrease the stress and strain in the carpals.